Hi, everybody. We'll be beginning in just a couple of minutes. If you haven't already, you can place in the chat where you're located in the world at the moment. We've got a quite a variety. Welcome, everybody. Just continue if you're just arriving to just type in the chat where you are in the world. It's nice to see the variety, mostly North America, but a lot of different places in North America. Welcome, everybody. We're just giving a chance for new people to show up. Maybe, Sean, what I'll do is begin with a few minutes of meditation practice, see how many people we can materialize, and then you can get some of the introductory remarks, okay?
That sounds great. Thanks, Ron.
Okay, so hi everybody. Let me invite those of you who are here already to turn on your cameras if you're not involved in anything too nefarious or illegal, um, so that we can see each other and come together as a community. Those who don't turn on your cameras will simply report that to the authorities. And let's start with, just since we are the Institute for Meditation and Psychotherapy, let's start with a few minutes of meditation practice. Just finding a comfortable and alert posture. And if you're comfortable, gently closing your eyes, feel free to do so. If you leave your eyes open, let your gaze be a kind of soft gaze cast downward. And let's just check in with how we're all doing inside. Perhaps we're coming from busy days. Perhaps some of you are coming from a last clinical appointment. And an awful lot of unprocessed material tends to accumulate in the day. So let's just check in and see the state of the mind and the body. For those of you just arriving, we're just beginning with a few moments of meditation practice. And maybe notice that if all is going well this afternoon or evening, the body's already breathing. That's excellent news. Perhaps tune into the cycles of the breath a little bit. Allowing all the thoughts, feelings, images of the moment to simply arise and pass as they will. If the attention gets hijacked by a chain of narrative thought, that's okay too. It's just the moment you notice that the attention has left the present moment. Just gently and lovingly bring the attention back to the sensations here and now. So far, our practice is very strong. We've materialized about 15 people since we started. Let's continue to bring the attention to sensory experience. And let some of the speed and the tension of the day begin to settle. For those of you just joining us, we're just starting with a very few minutes of meditation practice to settle the mind body and bring the attention into the present. I'm not sure how this bell will ring because we're on Zoom sound, but here comes a bell.
It was a magic bell. I didn't hear a thing.
That happens sometimes.
Oh,
Ding.
perfect.
So welcome everybody. And again, the invitation, if you're not doing something that you don't want people to see, to please turn on your cameras so we can come together as a community and talk together. And Sean will give some introductory remarks to orient you as to what this series is about and what we're doing here.
Thanks, Ron. Well, welcome everybody. We're so glad that you have registered and can actually be in with us for this. This is part of a series that we at the Institute have put together. If you haven't had a chance to meet you yet, my name is Sean Whitty. I'm on the board at the Institute. And this series is set up to be an AMA. If you're not familiar with that, the idea is sort of an ask me anything. It's very free floating within the context of particular topics. And this topic that Ron is hitting tonight is one that he is very familiar with, as I know that you know. So you'll have a chance to just ask questions, and I'll be watching the chat. If you have something, if you know you don't want to speak up, but I encourage you just to take turns, raise your hands, and we'll wander in. I want to just give you a heads up that our next community tea is on May 9th, and I'll be with Becky Side and hosting that. And that's really designed to be a really more of a community connecting time. We often break into small groups after some sitting and just process things together. And our next AMA will be on May 19th, and that will be with Susie Fairchild. She will be focusing on mindfulness and self-compassion and therapy. Other than that, there's lots of links that you'll find in the different places, like in the chat and in the email. And our hope is just that you feel inspired, that you feel supported in your practice, both professionally and personally, but that we sort of slowly get to know one another and our names and our faces. So thanks again for coming, and I'm thrilled. We're all thrilled to have you, Ron.
Okay, thanks everybody for being here. So our theme uh, is about psychedelic assisted psychotherapy, its promises and perils, and in particular its relationship to contemplative practice. And I'll just say a few words to orient you as to how come I'm talking about this, and a few points of view, and then but then we'll really open it up to discussion and your thoughts and your questions, and I'll share with you whatever insights I can generate about this topic. So for me, uh, this is a kind of a homecoming topic. Had it not been for a particular LSD trip when I was 17 years old, sitting on a street corner on Long Island, I probably would have been a mechanical engineer, not a psychologist and not a meditator, and never would have ventured into this whole territory of mindfulness and psychotherapy and compassion practices and psychotherapy. Because back then I had read a book which people familiar with the first renaissance, if you will, of interest in psychedelics in the late 60s and the early 70s, a book that Tim Leary and Ram Dass, who then was Richard Alpert, and Ralph Metzner had written called The Psychedelic Experience, which was based, think Buddhist scholars would say rather loosely, on an interpretation of the Tibetan Book of the Dead, focusing on Bardo states, these states that in Tibetan Buddhist traditions are said to arise when people are between birth and death. But it's really about liminal states more broadly, about these states that are between one form of personality organization, understanding, orientation in the world, and moving into another. And the authors had predicted that there would be something of a sequence in which, under the influence of psychedelics, if you approach them with a kind of contemplative curiosity, first there would be an unfolding of a lot of material from what we might call a Freudian or personal unconscious of, conflicts, injuries, traumas, large and small, and the like, coming back into awareness, but with a fresh perspective. And then if one was able to open to that experience, it might unfold into what we might think of as a more Jungian or archetypal realm, in which mythic images, poetic images, artistic images, images connected to indigenous traditions and the like would start to emerge in the mind. And if one were to stay open to those and keep an attitude of open curiosity and acceptance, the experience would transition into a kind of clear light experience, an experience in which there wouldn't be a sense of separate self, there wouldn't be narratives, particularly about me and others, that there would simply be awareness itself and a sense of the interconnectedness of all things in that awareness. And lo and behold, and we can discuss this, was this a matter of suggestibility, that because some models of psychedelics suggest that they open up periods of neuroplasticity and create a lot more suggestibility, perhaps, or perhaps there's something inherent in the potential of these medicines. But anyway, the sequence happened, and there I was, this kid sitting in this clear light state, amazed and with a profound sense that this mattered, and that indeed that what most matters is understanding how, without drugs, one might approximate this kind of awareness. Because to my 17-year-old mind, there were two things. One was, wow, an answer that has nothing to do with sex, because my girlfriend at the time, who I think realistic, and I don't mean this pejoratively, but she fit the criteria for borderline personality disorder quite well. And I was, I would go through quite a few roller coaster experiences based on my intimacy with her. And it was like, oh, it's not going to be, I don't have to solve that. And it's not about, achievement. It's not about the whole realm of, adolescent self-preoccupation, self-esteem preoccupation. It was a kind of freedom from all of that, but not in an adult sense, in a totally awake, alive, totally present sense. So that interested me in the topic. I wound up majoring in religion, even though I was a rather quite secular guy. Studied cross-cultural approaches to these sorts of transpersonal states. How are they generated in different cultures? How are they interpreted and understood that way? And then, eventually wound up training as a psychologist, but with this all in the background. And as you're probably aware, over the last few years, we're bouncing back from the war on drugs and beginning to do a lot of serious research into the application of psychedelic-assisted psychotherapy and its potential. Its potential appears so far, based on the studies, to be extremely robust, extremely strong. And interestingly, at least for some disorders, it seems that the degree to which people have these kinds of transpersonal experiences correlates quite strongly with the degree to which they experience clinical improvement. So the other piece of this involves the enormous synergies between contemplative practice, and I'm most grounded in Buddhist meditation traditions, but many can lead this way, and the psychedelic experiences. And the synergies work on a lot of levels. It turns out that mindfulness practice looks like it's really excellent preparation for psychedelic exploration. We don't have studies yet systematically teaching this to patients, but it sure looks like the attitudes that if you were to talk to Bill Richards, who is the last psychologist to legally administer psilocybin in the US before the war on drugs shut it down, he'd said, look, what we teach in preparation is trust, let go, and open to whatever unfolds. Sounds a lot like mindfulness instructions, right? This is not an accident. So this seems to be the attitude that is most conducive to positive and meaningful experiences in the psychedelic-assisted psychotherapy. And then there's the enormous project of integration. How do we make sense out of what unfolded, what arose during these experiences? And it turns out mindfulness practices, compassion practices provide the kind of open holding that can permit the processing of all of the material that that came up with, one of the mechanisms of action, apparently, in psychedelic-assisted psychotherapy is exactly the same mechanism of action that we see in mindfulness-oriented treatments, which is helping people to make friends with and ultimately integrate parts of themselves or experiences that were previously defended against, previously there's a strong aversion response to. So many, many synergies here. And parenthetically, I've also been involved for quite a few years now in psychedelic-assisted meditation practice, which is a very interesting adventure. I just came back from something we call Dharma K. This was the second year we did it, which was basically doing ketamine-assisted contemplative practice at a Buddhist retreat center. And it's very, very interesting. The synergies between these practices are become quite apparent, and it's quite easy to settle into a kind of loving, open, compassionate acceptance toward one's own experience and a deep sense of sangha and connection with others that supports the practice. And we even we're experimenting with inventing some practices. I'm happy to share those with you. I'm involved in a number of other projects like this that are pretty interesting. So that's where the interest is, why I'm talking about this. I want to say something about the perils part before we jump into talking together. Anything that is powerful enough to be useful in terms of psychological growth and development is powerful enough to be dangerous. Many of you know Willoughby Britton's work. She's about 15 years into a project looking at the adverse effects of mindfulness practices, and they are many. There are many people who go on retreats and have, well, I won't say this, but there are many reports of people who go on retreats and have a first psychotic break. And in that context, there are many people who drop out of MBSR programs where we don't necessarily know what happens, but when trying to run them down, they dropped out because they were just flooded by trauma. They were dissociating, things like this were happening. Mindfulness practices can be rough for some people, and this is one of the reasons why there's such an emphasis on if teaching these practices, allowing opportunity for people to report in on their experience. amplify that significantly by what can go wrong with psychedelics that are such powerful shifters of consciousness, and they work so powerfully to relax the repression barrier and bring us into contact with material that we usually avoid. And I'll assume many of you are psychotherapists, and we've all in our careers seen a fair number of people that tell us reports of psychotherapies that are cringeworthy, right? Really, the therapist said that, therapist did that, and where the person was really injured by it. And now maybe the reporting isn't accurate, but maybe it is. And, unskillful psychotherapy can be really injurious to people. Unskillful psychedelic assisted psychotherapy is a nightmare because people are super opened up. Their defenses are down. They're in a state of dramatically increased neuroplasticity, where whatever happens, they will learn from. And when people do boundary violations or the narcissism of the therapist gets in the way, it's not a pretty sight. So perilous as well. So I think I'll stop there. There's a little bit of an introduction to what my interests and activities have been. And I'd love to hear your thoughts, your questions, your reflections. And let's use the hand raise function in Zoom here. And there we go, Debbie. Just to tell everybody else, let's see, where's it living these days? I keep moving this. For other people who want to raise your hand, Sean, do you know where it is on the bottom here?
I'm getting, it says view. So Debbie, Debbie, why
Yeah.
don't you go ahead and
No,
unmute
no, I
yourself?
see it. Go ahead. I just want to announce to other people where to find it, but please.
Yeah. Oh, where's the hand? Yeah.
It's under reactions.
Under reactions. Yeah.
Okay,
Thank
good.
you for that introduction, Ron. That was fascinating. I am not a therapist. I'm a holistic primary care physician who's been interested in all kinds of alternative. And I've been wondering, is there any research on people who use psychedelics once or twice in adolescence? Are there any long-term sequelae from just occasional use? You've used more recently, so I don't think you'd be in the category, but I'm curious to know if one time has any permanent impact, if they've done any PET scans or any kind of
Yeah,
scans correlating all this.
that's a fascinating question. I have not come across any neurobiological studies on that, particularly when it happened a long time ago. There are many anecdotal studies of people finding it highly meaningful. For example, there was the Marsh Chapel experiment in 1962 that took place here in Boston at Boston University, and this was conducted by a fellow named Walter Pahnke, and he was a Harvard-trained psychiatrist, both medical school and psychiatric training. Who was working on his PhD from Harvard Divinity School. He had gotten very interested in these substances and gotten very interested in transpersonal psychology. And this was part of the Harvard psilocybin project, which was in the short life of that. It only lasted a couple of years. Tim Leary and Richard Alpert, who later became Ram Dass, were the heads of it. And once they started giving the LSD out to the Harvard undergraduates, that was the end of that. But prior to that, they were doing some rather interesting research, including this study that Pahnke had put together. And what he did was he got a bunch of theology students from Andover Newton Theological Seminary, for those of you in the Boston area. And he asked them on Good Friday to bring with them texts, statuaries, what objects of some sort that had meaning for them within their spiritual tradition. And half the group was given niacin, which makes your face flush and serves as a reasonably active placebo, and half the group was given psilocybin. And they watched to see what happened. And Pahnke developed for this something called the Mystical Experience Questionnaire, which was a questionnaire that basically asked people whether they have an experience of connection to something larger than themselves. And the details of it are having a noetic quality, which means it feels true. ineffable. I can't put it into words. A sense of connection to inner experience and outer experience. One of these real transpersonal experiences. And while there was one fellow where it didn't go well and they had to chase into Mass Ave after him and wound up giving him Thorazine, the rest of the group actually had so there's the perils part, but the rest of the group had these profoundly mystical experiences. And then Rick Doblin, who is the fellow who founded MAPS, the Multidisciplinary Association for Psychedelic Studies, which is the organization that has brought furthest along the FDA-approved studies. They finished the phase 3 trials for MDMA for PTSD, and the FDA is probably going to approve it in August. So Rick was actually an undergraduate, I believe, at Brandeis here in the Boston area. And for his senior thesis, he tracked down these people who in 1962 from Andover Newton had been part of this and did in-depth structured interviews with them. And almost all of them said it was the most meaningful spiritual experience of their life. And this was 15 years later. So they had been psychedelic naive. So there's a little bit of research evidence about at least the subjective take on this in a highly structured environment where people were very much oriented in a certain direction. So all those caveats, but given those caveats, that's what happened, which I think is interesting.
One other question. Has there been any research that gives any insight into predicting who might have adverse reactions and who might have positive reactions?
Well, the exclusion criteria in the studies, the only exclusion criteria are typically actively on certain medications, most prominently SSRIs and antipsychotics, or SNRIs. And the other one being having first-order relatives who've had major mental illness, really defined as either schizophrenia or schizoaffective, something in that area, or bipolar disorder. Now, there are anecdotal stories of people with such disorders reporting beneficial experience, but researchers don't want to go too close to it. And the reason for that is that there are a lot of anecdotal reports of people who had their first psychotic break under the influence of these medicines. Now, the prevailing belief among researchers and clinicians, including those with a healthy dose of skepticism about all this, is these are people who would likely have had psychotic breaks anyway, and this was the precipitant. Because there are many people who have psychotic breaks when the first breakup with their boyfriend or girlfriend, they go off to college, they lose their apartment,
Mhm.
disruptive events are usually part of an initial psychotic break. So it's likely that that's the case, but the researchers, I think, with reasonable caution, are saying, let's not mess with that. So those are the exclusionary criteria. Now, as to who will do well or poorly, very interestingly, in the MAP studies, and this is MDMA for PTSD, particularly in the first phase 3 study, which had about 100 subjects in it, they were looking for people with severe PTSD. So these were people who were often incapacitated, often had a lot of dissociative episodes. These were people who were not doing well and had a lot of unresolved trauma. And the improvements in the phase 1 study, where they looked only at severe PTSD, were more robust than in the phase 2 study, where they deliberately put in people with moderate PTSD because they were concerned that the FDA was going to approve it only for severe PTSD, and they wanted this to be made available to a wider population. So indeed, there were also quite impressive results, but not quite as robust as in the first study. To get FDA approval, you need to reach P is less than 0.05, so less than a 1 in 20 chance that the difference between the placebo group and the active treatment group is due to chance alone, right? They got not P is less than 0.05, but P is less than 0.0001. This is unheard of in psychiatry. Nothing works this well in psychiatry. So that was pretty interesting. And that was with the really severely disturbed people. It seemed that the more severely disturbed, the more robust the effect of the medicine was.
Thank you.
Sure. So let's see, whose hand was next? Susan?
Hi, thank you, Ron. I have a different question. It's a little bit different, and thank you for your response. So I'm wondering if you or anyone else has any information about Native American sweat lodges and how they mirror or look like or similar to or different than the psychedelic experience. And I've heard in the past, at times they may use peyote and or not. So I'm wondering if anyone has any information on that. Thank you.
Yeah, I have a fair amount of second-hand knowledge about this because since I got interested in this, I've had the opportunity to interview a lot of people who are involved in a variety of practices, including indigenous communities, including a fellow named Joe Taffor, who is a family practice medicine doc, who then studied and became an ayahuasquero in the Shipibo tradition. So down in Peru, years of study, learning how to do this. And he lives in Arizona, and he's been connecting with, oh, forgive me, I'm going to use the Anglo word Navajo. That's not what they like to call themselves. There's a different word that they call themselves in that that group. But with that community and kind of comparing notes on how this is done and actually mixing the medicines, like trying ayahuasca in a peyote ceremony and the like. And there's so many different indigenous traditions. It's quite hard to generalize. But some of the principles that seem to come up again and again are these rituals are very much embedded in community, so that the interpersonal connection with the other people in the community plays a very central role in how these are done. And even in the ayahuasca traditions, the medicine plays a variable role. It's the coming together in community and often having ceremony that is seen as most important, and the medicines assisting that. In the same way that we can talk about psychedelic assisted psychotherapy or psychedelic assisted meditation practice, that the idea is we want to engage in something, in an activity which moves people in the direction of health, and we want to use these substances to allow for greater shifts in perspective, greater neuroplasticity, greater openness, greater relaxing of defenses, and the like, in order to do that. And my understanding is that also with, in the use of peyote, that it's not so much about the medicine, right? The medicine plays a role, but it's within this broader context of community, safety, and healing rituals of different sorts. Now, sweat lodges in particular are part of if we step back, humans have been using non-ordinary states in healing since prehistory, right? Sweat lodges, fasting, wilderness journeys, ecstatic dance, drumming, chanting. I mean, all this stuff is designed to generate, I'm not equating them all as being exactly the same, but there's overlap among these activities, and they all involve cultivating non-ordinary states. And there would be many ways to describe this, but I'll just put forth one set of factors that many of these non-ordinary states have in common, and that mindfulness practices, compassion practices, and psychedelic work have in common. One is this relaxing of the repression barrier, really beginning to let in thoughts, feelings, experiences, emotions that very often we push out of awareness through distraction. Dropping below the level of thought, doing something that connects us to sensory experience rather than our constant narratives about experience. Surrendering into the flow of experience, a kind of getting it that we're not going to control this, and it's going to continually change, and we're going to continually have an attitude of openness to the fluidity of consciousness. And lastly, some kind of ego dissolution experience, a kind of moving away from, when we talk about ego, and I don't mean Freud's ego, I mean ego in the sense of self-preoccupation. there are basically two aspects of self-preoccupation. One is I want my desires met. You know, I'm hungry. I want food. I want sexual gratification. I want warmth. I want people to pay attention to me. I want recognition. And these often bleed over into self-esteem regulation as ego. I want people to think highly of me. I want to look good. I want people to think I'm kind or smart or generous or, whatever our particular building blocks for self-esteem are. Ego preoccupation involves, please see me this way. And at the more extreme end of the continuum, it's narcissistic personality disorder, but all of us have narcissistic disorders in the sense of being preoccupied with this stuff to greater or lesser degrees. So all of these non-ordinary states seem designed to lessen that as well. So there's commonalities, among non-ordinary states that I think are very interesting, and that the more I think we can identify these commonalities and see how they operate, then we as therapists can begin to think, oh, hey, there's some universal healing principles in here, right? Because integrating that which has been pushed out of awareness, learning how to drop out of the thought stream and not take our narrative so seriously, getting at the consciousness is fluid so we can ride the roller coaster of life, and letting go to the degree we can of the self-preoccupation. Yeah, those are all pretty important principles for psychological growth and development that we can integrate into any kind of therapy that we might be doing. So
Thank you.
bit of a long answer, but
Yeah, thank you so much.
yeah, sure. Amma.
I'm loving this. Thank you so much. This is just really enjoyable. I'm interested in hearing more because you mentioned integration was a big, big, big important part of this. And what I'd love to hear is what are the components of integration that supports people taking these wide open experiences and then having them have a tangible access to them in their daily life?
Yeah. Well, the first and foremost seems to be coming back to some kind of safety. Right. I mean, this is why doing these, having these experiences and then, going back to the homeless encampment or going back into an abusive relationship doesn't seem wise, because we need defenses, right, to deal with some of these really threatening circumstances. There was a very interesting study. Trigger warning, everybody. Quite a number of people who were at the concert in Israel that was attacked by Hamas, and where so many people were murdered and kidnapped and that kind of thing. And a great number of them were high on psychedelics at the time. And a group of Israeli researchers have been systematically interviewing them to ask, it's hard to even imagine the question, but what was that like? And this is about the opposite of safety, right? And it's not about integration so much as during the experience, but it lends an interesting perspective. And the responses are, everything from, completely paralyzed, I couldn't move, I couldn't do anything, completely overwhelming, horrible, to it gave me a kind of perspective where I could just think about what needed to be done and just act and actually have good executive functioning, which is like, that's interesting, because in general, these medicines aren't great for executive functioning. I would not advise doing your taxes, during a psychedelic episode, right? But yet some of them found that. And some of them reported that even though it was horrendous what happened, they had a kind of spiritual perspective on the whole, some kind of grand perspective that was able to see the suffering from many different angles and the like. So that's very interesting. And that, but in general, we want to have a lot of safety for people. And then it's, these medicines open the door to psychotherapy. So, whatever the issue is for a given individual, if the pathway to treatment is going to be mostly relational because there's relational attachment wounds, then therapy that addresses those is what's called for. If it's mostly about the whole feelings of inadequacy and the kind of self-esteem stuff associated with that's so part of depression, then it's a little bit more the spiritual perspective and actually getting it how rather arbitrary and contextual and contingent all of our thoughts about ourselves and preoccupations with ourselves are. So it really seems to depend a lot. And what people who are involved in doing the integration do is they try to be very open and very curious. Now, there's quite a few projects going that take the point of view that, well, we know that some forms of treatment seem to be empirically supported for some disorders. So why aren't we using those as part of the psychedelic assisted psychotherapy? So there have been projects, for example, with ACT, acceptance and commitment therapy, kind of, training people in basic ACT skills beforehand and then using ACT as part of integration. I think it makes a lot of sense that we start to do that with mindfulness practice, teaching mindfulness, practice beforehand and having people do mindfulness practice a bunch afterwards with a therapist to talk about what comes up in the process. There's a lot of work happening with IFS, internal family systems, with people who are already this comes partly out of the observation that spontaneously, this isn't large scale study, these are small n studies, but something like 80% of people who are naive to the constructs of internal family systems, when they're in their medicine sessions or shortly thereafter, start to talk about parts. They start to say, well, a part of me felt this, a part of me experiences this, I got connected with this part of me that feels this way. People just start talking that way. So that suggests, hey, what if we did that? What if we did kind of IFS work? What if we did EMDR work afterwards? So, it's all at its infancy in terms of research around this. Typically, what happens is the same thing that happens in the therapy field more broadly, which is whatever kind of therapy we tend to do, which is often the kind of therapy that we found was most helpful personally for us, we wind up trying with people in integration. I have friends and colleagues who are kind of modern psychedelically informed psychoanalysts, right? Who are doing psychoanalysis in a very alive way. I mean, you think about free association, for example. Free association is a very trippy, non-ordinary state. If you can really lie there and you can really say whatever comes to mind, it gets very weird very quickly, right? Because it's a softening of the repression barrier, and you're entering more into, what analysts would call primary process. And psychedelics, primary process, they are primary process experiences. So the idea of afterwards, let's do free association afterwards and see what comes up. Well, in a safe environment, that's sensible. So I think there's a lot of avenues. I think this isn't fleshed out, and it's interesting.
Thank you very much.
Yeah, no, you're welcome. Sharon.
Hi, thank you. I want to speak real quick to I'm an Indigenous woman who does sweat lodge and also psychedelic assisted therapy, Chiron's dose level. So just to speak, and I appreciate, Ron, that you identified that every culture, every tribe has their own traditions. So to use the term Native Americans or Indigenous people, you really have to get specific about the tribe. And I think yours may have been the Dene tribe.
Yes. Thank you. You've takes a village to complete a sentence.
You're welcome. So just like you wouldn't do psilocybin and also smoke weed, you wouldn't mix medicines. Sweat lodge is one medicine, psychedelics is another. So anybody who's doing that, I personally would question and not get involved because spiritually it's too strong from a traditional Indigenous perspective. other people are mixing cultures too, so I don't want to speak to that. But my real question is, when you spoke about meditation and psychedelics, are you meaning like hero dose, and then you sit in a meditative session with a client? Or are you talking about microdosing and then maybe with a group of clients? I wanted to learn more about that because that sounded intriguing. I haven't heard of that.
I'm
before.
not talking about clients at all here at this stage in the
Oh, okay.
development of this. I'm talking about therapists or workshop participants who are interested in this, but not really in a clinical setting. In a setting of spiritual exploration. For example, this Dharma K project involved, they're mostly therapists, not everybody, but people who had established meditation practices and also had an interest and usually some experience with one psychedelic medicine or another. So it was within that context of exploration. And then, there are a number of us in the Boston area who've been exploring this, and dosage is a very important variable. Using, for example, psilocybin mushrooms, it would seem, and this is just collection of anecdotes. Okay, it would seem that let's say you're doing something where you're starting with meditation practice and you're trying to hold the frame, and then introduce a medicine and hold the frame with, say, this is very imprecise, but 2 grams of dried mushrooms. It's possible to hold the frame at the beginning. There's a point for most people where 2 grams is sufficiently strong that it's as though we could conceptualize 2 things. One would be psilocybin-assisted meditation practice, and the other would be meditation-assisted psilocybin journeying, right? It would seem that at around a 2-gram level, it shifts at a certain point from psilocybin-assisted meditation practice into meditation-assisted psilocybin journeying for a spell, for an hour or 2, but then it can come back into psilocybin-assisted meditation practice. And at 1 gram, it's more possible for many people, it seems, to do simply psilocybin-assisted meditation practice, where there's always a sense of the breath as an anchor. There's always the sense of identification with awareness itself through the experience, as opposed to being swept into the river of consciousness that happens at the slightly higher doses. The more heroic doses, 3, 4, 5, that's really, the way I would conceptualize it is somebody's using the meditation practice as preparation for their journey, and then perhaps as integration at the end. But the journey so takes over any kind of practice structure that it's not going to happen. And similarly with ketamine at relatively low doses, we experimented, for example, with a very low dose of 10 milligrams intramuscularly. Okay, so an injection of 10 milligrams, which some people say, well, that's not going to do anything. When people are meditating, you notice that people are already much more sensitized. So it's one thing to take one of these medicines and walk around the world, or have the phone in front of you. It's another thing to do it in the context of practice, where a small intervention is quite palpable. And people doing that, again, purely anecdotal, just some reports, many people felt like, oh, it feels like it's day 4 on a retreat with that light dose, because the body settles, the thought stream quiets, there's sensitivity, there's access to inner material, but there isn't so much jumbly, restless. Sorry, the rest of you may be far more advanced in your spiritual. but when I sit down at the end of a busy day, or there's a lot going on here, and sometimes there's the breath, but there's a lot of other things happening in consciousness. With this, it's like mostly the breath is happening and other, some spaciousness with which to observe these other things. Again, this is very, very preliminary, very just some ideas here, but there's an interesting relationship really at the lower doses where you really can do psychedelic assisted meditation.
Right. I like that. I microdose regularly, but that's subsensory. So what I'm hearing you
that's-
say is mild sensory, maybe,
This
versus
is higher. This is higher than a microdose. I mean, the idea of a microdose is you're not going to actually feel it directly, right?
yes,
This is a little higher than that, but not a lot higher than that.
okay. I'll play around with that. That sounds exciting.
And let me say, none of what I'm sharing here is professional advice for anyone. I want to
I
just
hear you loud and clear.
nor endorsement for doing anything illegal. There are legal avenues for everything that I'm describing. I want to make that really clear. And I'm extremely conservative about this in the clinical arena, because I think anything we're doing in the clinical arena with this, we have to be able to imagine the malpractice trial in which we're explaining to the jury or to the judge why it is that we're involved, that we were suggesting an illegal activity for a client or patient. I don't ever want to be in that chair doing that. So
I hear you. I agree with you wholeheartedly.
Yeah.
I have clients and I would never, I don't even want to be a psychedelic assisted therapist
right,
for that.
that's a help.
For that very reason, but I myself have benefited from it, and so I learned this to apply on my own guinea pig. I think a lot of us are like that.
Yes, I think there is a lot of that. And, the same way I think sitting a silent meditation retreat has the potential to be really powerful training for anyone who wants to be a psychotherapist. These experiences have that potential too, in the right context. I want to just say a little more about the perils, because it's easy to get excited about this and enthusiastic. And I think very interesting things are happening in the field, and there are perils. Not the least of which is, this is a rather unflattering archetype, but imagine that there's a stereotype. There's a 29-year-old guy, they're usually guys, who has been kind of floundering around in life. Relationships haven't gone all that well, has a degree in the humanities, very bright, with, a lot of potential, but hasn't really engaged in the work world in a way that's meaningful, has been in and out of living in his parents' basement. And he starts to work with these substances, and he starts to have these profound non-ordinary states, including genuine mystical experiences, genuine experiences of ego dissolution, starts reading spiritual literature, starts seeing how this is embedded in what Aldous Huxley used to call the perennial philosophy. So many traditions around the world have come to overlapping or parallel realizations. And he starts telling people about it. And, inside of a little while, he's basically hanging a shingle out as a shaman. And what could possibly go wrong? Well, a lot can go wrong. And there's a lot of this happening in the world. So I really want to simultaneously talk about the rich and interesting potential and the synergies with what we've been doing with mindfulness and psychotherapy. And let's be really careful. I'm not saying keep stuff illegal. It seems crazy to put people in jail around this stuff, but something so that we're not just saying, oh yeah, this is the way to go for everybody.
As someone who really believes in it and practices it myself, most people I tell don't do it. In fact, anybody I've talked to about it, I said, this is what I've done, but I don't recommend it. It's just really helped me in this way. If you ever did it, go find an actual professional who is certified and do it. And I always say, do 6 months of therapy with that person beforehand and expect to do 6 months afterward. That's the only way I'll recommend it if I recommend it.
And while the research studies have been really promising, and the results in terms of reduction of PTSD on scales that measure that are impressive and robust, there are a lot of people who are left at the end reporting that, Well, yeah, it really helped with my PTSD, but now I'm super opened up and I don't really have the ongoing therapy and community support that I need.
And that's where it's tragic. And that to me is a peril. And if you're not invested, I think, on one hero's dose, if you're not invested in a year's time of process,
Yeah.
I would never suggest anybody do that because it's intense.
I have a friend and colleague, Rosalind Watts, who's also a Dharma student. She's in the UK, lovely psychologist, and she's developed something called the ASSER Integration Program. Forget what ASSER stands for, it's an acronym. But basically what she's trying to do is develop communities, started during COVID. So a lot of them are online communities where people can feel safe to do integration work together in community. With guidelines and rules and ways to try to keep it so that people won't hurt each other, but will support each other and listen to each other. I think we're going to need a lot of culture forums to do that kind of thing, because therapy is expensive, and I think it's ideal to do what you're talking about, and that's all I would be involved in. But
Right.
I think we also need to be creative about that. And Bill Richards and Brian Richards, who are at the Aquilino Cancer Center in outside of Baltimore, they're connected to Hopkins. They're really trying this with group models. They're really trying to say, okay, let's do group preparation and let's do group integration here, but ongoing group integration, so that people have support. So,
well, that's responsible, but not group medicine meeting.
no, but they're trying to scale that too to make it more economically accessible. What they're doing is interesting model. They have a clinic that's set up with basically cameras in each of the treatment rooms, and they're very nice treatment rooms for this that are designed to be homey and like that. The sitters are not necessarily highly trained professionals. In other words, the person who's actually sitting with you, I don't remember if they let you bring in a friend or whether they have people who are a bit more kind of at the paraprofessional level, but there are available to the sitters so it's a simultaneous session where I forget whether it's 6 or 8 patients are going through this. And they've got at least a couple of highly skilled, highly experienced mental health professionals who are there monitoring everything and kind of coming in and out as needed to provide support to the sitters if the sitters have questions, as well as support directly. And they're reporting that it seems to be working pretty well for safety at a fraction of the cost, because the standard model that's being used in the studies is 2 therapists sitting with you for 8 hours. And if you're going to pay the therapists therapist wages, that gets extremely expensive, very quickly, not to mention the therapist for the preparation and the integration session. So it's so that people are trying to be creative to think, is there some way to scale this or disseminate it more widely?
Well, I hope that really happens and not in a dangerous way.
Right, exactly.
Charles, that's what drew me to this. So thank you very much. That was great.
Yeah, thank you, and thank you for clarifying a bit about the indigenous use.
You're welcome. Wada.
Jonathan.
Huron, this is amazing. I guess just a thought and then a question. I'm just struck with how different it seems psychedelics are from traditional drug categories. So for example, like SSRIs or statins, there's like sort of a new molecule that comes out, it does a particular thing, and then there are variations on it. But this feels almost more like electricity or some new like fundamental element that can be really thought about in so many different ways. And I just realized, because I was going like, well, why am I here? Like, I'm interested in this from a lot of different directions therapeutically, but I realized actually my personal passion would be whether it's possible to use these in community interventions to help people in communities to actually be able to sort of wake up, listen to their neighbors, be aware of themselves, and then ultimately put like Trump supporters and non-Trump supporters in the same room, all on like psychedelics, and see if we could actually become Americans again. That's my research interest. But my question is, I have the sense that there's like 5 or 6 or something like that kind of significant psychedelics, and I'm curious if you could just give a summary of like what are the most important psychedelics,
Sure.
and why are they important? Are they variations on each other, or are they fundamentally different?
Sure. Yeah. No, great question. And just be careful with that study you have in mind, because I can see it going sideways also. But as an aspiration, I'm completely with you. I'm completely with you. And one of the things I'll say that I've experimented with in some of this sort of psychedelic assisted meditation practice is, okay, can I look at the things in my world that I tend to have an immediate negative judgments about? And that includes looking at figures and this, nothing about who it is in particular for me, whoever the figures that you don't like in the other political party might be. Doesn't matter, because there's a lot of symmetry here. If you talk to Trump supporters, their views of Biden are not that different from Biden supporters' views of Trump. And can you look at it and with a few questions like, well, can you connect to the inner Trump or Biden? That becomes very interesting. In what way am I like this person that I've been hating here? That becomes very interesting. And the other one is, what factors and forces made this person become as they are? And both of those questions with a number of psychedelic medicines are quite open to exploration without judgment. So there, I think there's something to what you're saying. But let me step back and give a little bit of the overview. So these medicines can be classified by their organic chemistry families and how they're similar to one another, or by their effects, if you will. And interestingly, there are different medicines that are called classical psychedelics in that they seem to have fairly similar effects, but they're in different organic chemistry families. So that's a big question the neurobiologists are constantly trying to figure out. But let me talk about them in terms of families of types of effect, because I think that'll be easiest. What are often called classical psychedelics, and the ones that show up most in the research, by far psilocybin is the one that's been studied the most. Second to that is LSD. LSD is easy to manufacture relatively in a very pure form, but it's a 8, 10, 12-hour experience. So the research study, you have to have resources for this. It's quite the commitment. Peyote, of which mescaline is the dominant active ingredient, or San Pedro cactus that also produces mescaline. Those are the most common classical psychedelics, and effects are quite variable based on set and setting. So set is the mindset, if you will, the intentionality, the understanding with which we go into this. And I would say parenthetically, if you're steeped in mindfulness practice, and particularly in something like Buddhist psychology, it doesn't have to be that flavor, but these ways of looking at the mind and self and all that, there's likely to be different effects than if you're not, or than if you're coming at this from another cultural perspective. Charles Manson and his gang committed murders on LSD, while other people say, well, LSD is, reveals God or reveals interconnectedness. So set matters a lot, and setting matters a lot. Are you at a Grateful Dead concert, or are you lying down with eye shades and going inward with therapeutic support? In many ways, set and setting are more powerful variables than the variance among the substances. So just to put that out there. But the psychedelic the classical psychedelics tend to create visual effects that are hallucinatory. The hallucinations in general, if the eyes are closed, they're just whatever is arising from the unconscious. If the eyes are open, the hallucinations are usually not out of plain cloth, if you will. It's more, and I came across the word for this and I've since forgotten it. There's actually a word for when you see faces in clouds. When you look at something which is kind of ambiguous. This is what projective testing is based on, right? That we show you ambiguous stimuli and you see stuff in it. They tend to create that kind of hallucination. In other words, clouds, tree bark, everything starts to become the suggestive of moving, changing images of this sort. And the imagery that arises tends to reflect affect. So if a person is very frightened, they're likely to see monstrous imagery. If a person is feeling safe, they're likely to see angelic imagery. So the imagery kind of reflect. This is one of the ways that people get into bad trips so easily is if I start to get frightened and I start to have an aversion response, I don't want to see that. I don't want to have that experience. Well, that attitude is going to result in sympathetic arousal, which is actually going to trigger more of these unpleasant images. And then the person can get even more scared. And that is the central phenomena in a so-called bad trip that happens, where a person gets into a fear imagery, fear loop like that. So classical psychedelics, that can happen but they're also very conducive to transpersonal experiences, mystical experiences, and the like, in which people have a sense of their conventional sense of self deconstructing and have a sense of interconnectedness with all other people, all other beings, a deep sense of common humanity. Those themes arise pretty frequently with classical psychedelics. Then, and of them, again, psilocybin, the main studies, mostly so far in end-of-life care. The FDA just gave, what's the phrase? I'm forgetting the phrase, but fast track for studying LSD for anxiety of all things. That just happened last week. I mean, that's pretty interesting. I don't think of LSD as like, I'm kind of anxious. I think I'll drop some acid. I think, whoa, really? But in the right context, apparently so. I think it's phase 2 studies that are looking very promising on that. So then the next group, which is worth paying attention to, are the drugs like MDMA, which don't tend to create a lot of this visual effect. They tend to create a sense of love, loving, acceptance, and lovability. So they connect people very readily. In the Boston area before the war on drugs, a lot of psychiatrists around here were doing couples therapy with MDMA. The Times had a fascinating article of people, all anecdotal, but couples that had been on the verge of divorce, took MDMA together and decided, that's a stupid idea. They remembered why they loved each other and could begin to connect. It makes it very easy to let go of self-oriented view. And it's MDMA, which has been most powerful in these studies with PTSD. And Bessel van der Kolk, who many of you know, he was the principal investigator for the Boston site. And he convinced them to add a self-compassion measure. And bingo, it turned out that the variable that changed most with traumatized people was an increase in self-compassion. Because so often trauma involves hating oneself, judging oneself negatively. It's clear that that's the case when it's moral injury, the combat vet who is involved in killing kids and, can't live with themselves. Yes, but even when we've been very much in what most people would describe as a victim position, still the feeling of being damaged, of being no good, of being different from everybody else. Why do I have, why do I have no courage? There's a lot of self-criticism. That stuff tends to melt as people feel connection to common humanity and connection to one another. And people are much better able to see, well, of course, I am who I am this organism is the result of factors and forces, and how could it be otherwise? And a real kind attitude that way. So that's and MDMA is there's many variations, but that one's got a lot of that effect. And then there's ketamine. Now, ketamine is chemically very different from these other medicines. It's called a dissociative anesthetic because it can be used in the ER. Somebody comes in with their arm mangled, you can give them an infusion or an injection of ketamine, and you can work with their arm, and they're okay with it. They're somewhere else during the experience. And ketamine is very interesting psychotherapeutic because it's so different at different doses. As I was explaining, at this light dose, it kind of fear drops away. There's a kind of settling. There's a kind of perspective taking, and it's one can meditate and pay attention. At a sort of more moderate dose, one can also do meditation practice, and one can direct the attention. What I wind up being drawn to personally with these kind of moderate ketamine doses is I want to investigate all of my traumas. And I have not had big T traumas in my life of terrible things happening, but I'm talking at the level of my high school girlfriend. I'm talking at the level of, trailing behind my big brother when he and his friends tolerated me, but I was a little kid. I'm talking about normal developmental trauma. In my case, just because I've had it pretty easy up until now. I've reacted as a traumatized person, but that's just because of factors and forces. But in terms of actual events, they haven't been horrendous events by most people's standards. And just a willingness and interest in investigating all of them, and with a perspective of just seeing the utter folly of having spent a lifetime trying to keep my self-esteem intact, trying to have people think I'm smart, trying to accomplish that, just the utter folly of that being completely obvious, but some capacity to direct attention and explore these things. At higher doses, what happens is people enter into these streams of pure consciousness that are extremely fluid. There is no sense of a me in the mix. There's just the unfolding of consciousness, and oftentimes it's hard to have clear memories of it because it is such a different state than other states. So that's it's its own kind of kettle of fish, which I would say at the low dose and the moderate doses are really useful for both meditation practice and psychotherapy practice. So that's a bit of an overview of there's ayahuasca, of course. I'll throw that in the mix. So ayahuasca is made of two vines that somehow people in the Amazon 1,000 years ago figured out that one of these vines contains DMT, but if you ingest DMT, it breaks down very, very quickly, and the drug effect lasts for a very brief period of time. But there's another vine that's an MAOI. It's a monoamine oxidase inhibitor, and it's monoamine oxidase that breaks down the DMT. And if you mix them together, you're basically taking an MAOI, which stops the breakdown of the DMT, and you can have this journey all night. Like the classical psychedelics in some ways, but again, it's within the ritual context where people see the plant as a teacher, and there's a lot of discussion of Mother Ayahuasca. So people experience lessons coming from the plant. That's it. And again, you can't separate the ceremony from the drug effect. Often tremendous gratitude.
I just want to mention one really quick thing related to ketamine. So I think I'm a little bit of a unique combination of a very dedicated long-term Buddhist practitioner and someone who suffers from chronic, severe, major depressive disorder. And as a result, I've done ketamine treatments several times, but I've sort of been using them as kind of scientific experiments and laboratories. And what I feel like I found, and I don't know if this is consistent with other research, is that it's not the ketamine almost like creates like an operating room. And what happens over time is that I've learned to actually be able to repair my brain under a deep, and I'm using a lot of meditations and supports, but it's like I feel like I can find and actually work on and feel, real progress on. Because my thought is, well, I grew my brain in the first place, right? It just started as a cell. So if I can grow it, why can't I fix it? So I don't know.
Well, that, the study, there have been animal studies of ketamine that suggest that there is a period of neuroplasticity and it's dose related, but for some days afterwards, in which the animal can learn new things. And one way that people understand ketamine, I don't know if you're using it in the context of an infusion clinic that's not a psychotherapist's office kind of thing.
It's a psychiatrist in an infusion clinic. Yeah.
And is he doing CAP, which is called ketamine assisted psychotherapy, or is he more administering this as an atypical antidepressant?
No, I'm trying to teach him about what I'm doing because I think I'm getting like so much more out of ketamine than anyone else there.
Yeah. Well, that's it. The people that I've worked with who have been at this in a big way for years now, they lament that often the ketamine infusion clinics are missing an opportunity to help people work psychologically with the ketamine. It sounds like you're finding a way to do that. There is a kind of shift in perspective that happens with ketamine, which is quite dramatic. It's akin in many ways to the shift in perspective that happens if you go on an intensive meditation retreat, where after a certain period of time, there's a greater sensitivity, a greater openness, and just a greater ability to have perspective on our thoughts and feelings rather than being locked into identifying with them. And that seems to be part of what's how it can have a therapeutic effect. But there's so much to learn, and it may be really different with different people, but it's interesting, and it sounds like you found it pretty productive in terms of not staying stuck.
Well, I think it's potentially a whole new venue because it is to me like being on a long-term meditation retreat. When I'm under ketamine, I'm like in a very similar state, but it's something beyond that because I'm actually engaged in the process of healing.
Yeah.
It's like a mindful state that's like looking for injury and working on healing.
That's interesting. That's not that unlike me poking around looking at trauma just because it feels so safe to do so. I really want to do that.
Yeah.
No, thank you. Rachel.
Thank you.
Hi, everybody. Hi, Ron. I don't know if you remember me. I'm from the 2010 psychotherapy and mindfulness and psychotherapy certification. And I had the pleasure of meeting you in your office one time many years ago. This is really, really great. I'm excited about the idea of psilocybin assisted meditation practice. I hadn't thought of that because I do have ketamine for home use right now. But I wanted to recommend this book. Has anyone seen it? It's called.
We're in the middle. Wait, which one is that? Who's the author?
It's called Psychedelics and Psychotherapy by Tim Reed and Maria Papaspriro.
I have not actually seen that book.
It's phenomenal, you guys. It's from 2021, and talking about group work, they do go into group work, a few of the chapters, and I mean, these folks have been doing it underground for years, and they were talking, one of them I'm listening to now because I have it on Audible too. She's talking about starting off with MDMA and then 3 hours later putting in some LSD or vice versa with groups, and she said they kind of have a potentiation effect, but she decides on which one to use with the group together based on what they want to get out of it, whether it's trauma healing or more transpersonal stuff or whatnot. So it's fascinating. So I wanted to just mention that. I stumbled upon it.
Yeah, thank you.
And I wanted to say, I've been taking a bunch. I'm in the experimentation and training phase. So I took some classes with Fluence. The Buddhism and Psychedelic Assisted Psychotherapy is a phenomenal course. It talks a lot about what you're talking about, the synergies. It was really good. And integration and harm reduction. And I heard Elizabeth from Fluence say that it behooves us all to take some at least integration and harm reduction, because people are going to be coming to our doors more and more often
Absolutely.
from going down wherever they're going for ayahuasca or whatever. So that was really great. But my question mainly is, I have been looking for a mindfulness-based therapist who's psychedelic savvy to help me with integration after a session. You know what I mean? Because my therapist is wonderful, amazing. I do great work with her. My CAP provider, you know, I meet with him periodically to see how my home use is going, which is great. But I would really love to talk about some of these synergies. And like after I have like a heroic psilocybin, I would love to have someone to process that with, you know. And so I tried to reach out to some of the folks from M&P, and I haven't.
Where are you? Where do you are you in the Boston
I'm
area?
doing it all underground. I'm doing
I know,
it. With
but are you living in the Boston area?
No, I
Oh,
wanted
well,
to.
I mean, people do this stuff remotely anyway.
Yeah.
Let me, I'm gonna just give a shout out to a group here that,
That would be so great. I've been looking for over a year, trying to find someone, even if it was just like not regularly, but just after a journey.
let me see if I can,
Okay.
come up with the name of the
That'd
group.
be great. Thank you.
Okay, so this is a group of people who a combination of very experienced Dharma students. They're all legit licensed therapists, as well as people in the IFS world in this group.
Great. Awesome.
And I'm going to just put it in the chat. I mean, I
Okay.
have no idea about their availability. They do
Okay.
CAP work, but they also
Okay.
do integration work for
Okay.
people.
Yep.
And here comes in the chat.
Yeah, and I'll just say I had a few underground folks. One ended up being really narcissistic that I had to pull away from, and another one hung up on me the other day. I was trying to process like something that felt a little disjointed in our communications before our journey, and she actually, her ego got threatened, and she actually hung up the phone. So,
Yeah, it's
like you're saying, and her website looks beautiful, but she's not licensed, and I know there's some non-licensed that are really good shamans and everything. I saw up in Vermont, she was amazing, non-licensed, but there's a lot of other folks who really.
It's very hard. I mean, you know, we all know there are licensed psychotherapists who are not very skillful.
True.
Also, you know,
Yeah.
it's hard. So the question about supervised therapeutic MDMA, very, very difficult at this point. You got to wait till August probably. Because all the studies are done. And in addition to studies, I'm responding to Debbie Silverman here in the chat. And so there's a possibility of entering into a study when the studies were going on. The FDA has opened it up to what's called compassionate use, which means, you know, letting a very limited number of people do this for when there's a promising treatment for anything, you know, and the harm possibility seems low. So, excuse me. So, but that's very, very hard to get. I think it's for MDMA, I think it's about waiting until August. And there is one group that has now written a letter to the FDA saying, let's have public hearings. We're concerned that the people doing the studies haven't been sufficiently candid about difficulties that people were having in the study. So that, I don't know if that's going to derail it for a while or not. Any other, we're getting near the end of our time together. Other thoughts or reflections or questions? All right. Well,
I have a question, Ron.
Oh yeah, sure. Go ahead.
You know, this is somewhat self-interested in terms of the Institute and wanting to continue the conversation. You know, where would you, I suspect there are a lot of folks that, you know, not unlike me, that are doing clinical work and want to continue a conversation and be in the loop with these things. And I'm wondering where where people find each other and around these conversations you're having.
Well, there are a training program, like I serve as a mentor in one of the year-long training programs about this. I mean, the certificate program that IMP does has a module on this, but it's a brief module. It's with Gita Vade, who is, she's one of the brilliant psychoanalytic people
Wow.
doing psychedelic assisted work. But it's a small part of the overall program. I've been part of the program at the California Institute for Integral Studies, which is a year-long training program. I will, when I'm involved in trainings, I'm doing a week on this on the Cape. Actually, I will mention that.
Okay.
If you go to my website, which is I'm not good at self-promotion. Let me do this here.
I actually have a resource and links page that I'm going to give to everybody that has your website on it.
Excellent. So drronsiegel.com. If you look for upcoming programs, I'm doing a week-long program on this. Learning from non-ordinary states. It's basically about mindfulness, compassion, and psychedelic assisted therapy on Cape Cod. For it's one of those deals where we're together from 9 to 12 in the morning, and then you can hang out and have long mindful walks on the beach. So that's one resource. I mean, there are a lot of people involved in this now. I mostly just know the little worlds that I'm interacting with. So, Sean, do you want to say a few words? I don't think you got to give the Donna talk. Let's do
Yeah, I
that.
just wanted to these offerings are offered in a spirit of an opportunity to practice dana, which in our practice and in the tradition that undergirds our the institute in our community is about generosity. So I will put a link in the chat with a few resources that include an opportunity to offer dana, as well as other offerings like the certificate program at the institute, which is had recently combined with the Berry Center for Buddhist Studies, and it's an exciting time to be a part of that. So click on that link, and you'll be able to get some places to connect and continue the conversation. And as I said, the most immediate opportunities we have are coming up with the community tea, which is really more of a connecting time at our next AMA with Susie Fairchild, digging into things that Ron you brought up in mindfulness and meditation and self-compassion. So this has been really great. Thank you.
Thank you. I will take one more minute, Jeremy. I see your hands up. If it's something I might address quickly.
Oh, sure. Yeah, I don't know if it's a quick address, but I put it into the chat and I thought I could just read it. So my question is, if you see that clients are becoming attached to the ketamine or the psychedelic experience and find themselves more drawn to that state as somehow more valuable or real, how do we help them as integrators or therapists orient themselves to their everyday experience as equally as meaningful?
You're right. It's not a small question. I will say, of all the medicines, ketamine probably has the greatest dependency danger to it, because it's often pleasant for people. Affectively, it tends between either ecstatically revelatory or at least not unpleasant, even when people are facing difficult material. Whereas the other medicines, it's a journey into heaven and hell. So that they may have one or two experiences that are just lovely and beatific, but sooner or later people will have experiences of grappling with their shadow, grappling with death, grappling with human cruelty, and so it's a little people are a little less likely to start doing those all the time. And what they find from the studies is people are not typically getting into unhealthy use patterns, finding the stuff outside of the studies and having substance use disorders with it. Now, that said, and I think it's a really important point, Paul Fulton, who anchors the certificate program and a longtime member of the board and colleague, Paul points out that in his youth, he had some psychedelic experiences that were very powerful, very transpersonally meaningful, But then when he got into his meditation practice, it was like, how do I get those experiences, right? He got attached to these transpersonal liberated experiences. And indeed, Jeremy, as you point out, and my pal Jack Kornfield, who should get a Pulitzer for the title of his book, After the Ecstasy, the Laundry. Yeah, that's very important, right? How do we translate the insights into living ordinary lives with as much kindness as possible? And I think it behooves us as therapists to point out that the insights that come from these medicines are wonderful and need to be in the service of living a life which is aligned with those insights. So if the insight becomes, oh gosh, all this self-preoccupation has really been pretty ridiculous and harmful, or, or an insight of, fundamentally everything's love, or what matters is love, or these kinds of insights, then it's like, okay, so how are we going to live that way when we go to the grocery store? How are we going to live that way when we're dealing with a customer service representative on the phone who really isn't understanding what the company has gone wrong, and on and on and on and on, right? How are we going to live that way when we're dealing with people in the other political party, whoever they may be? So I think part of our task as therapists is to raise that and to talk about, the very challenging task of living as though we're a sane person, not only touching into it in these dramatic experiences.
Cool. Thank you very much.
Yeah, thank you. So thank you, everybody. Lovely to have you come out. As you can see, I enjoy talking about this. It is interesting and a lot of fun. And I hope that the conversation has been interesting and useful to you.
I hope to be at your next year's Dharma K. I hope you send it out sooner this time, Ron, because it was like not only a few weeks or a month, and I couldn't, change things.
We do have the dates for next year.
Oh, wow. Okay. I will make sure that I.
And since we're on the phone, I will tell you it is mark your calendar, April 22nd to April 27th next year.
I got a friend already gonna be going with me, so that's great.
Okay, I will send out something
Awesome.
to everybody, so it's not last minute. Yeah.
Sounds good. Awesome.
All right.
Thanks. Namaste.
Farewell,
Thank you,
everybody.
Bye,
Thank
everybody.
you.
Be well. Hope our paths get to cross
Thanks,
again
everyone.
sometime, somewhere.
Me too. Bye.